Tens of thousands of Americans undergo surgery each year to alleviate lower back pain. Well, now there is a new type of spine fusion.
In 1994, Billy Lucas injured his lower back. Over the years, no amount of therapy, surgery, or medication has brought him quite back to normal.
I'm living in a world of pain and I'm just not digging it.
Lucas heard of a new surgery, a less invasive spine fusion procedure called Axialif. A surgeon makes a small incision by the tailbone. Then, looking only at continuous snapshots of x-rays, the doctor guides his instruments to the lowest disc in the spine.
Where you don't see what's going on inside, you have to really, in your mind, have a good idea of what you're doing and also be able to adapt to what you see on the x-ray machine.
The doctor replaces the bad disc with bone and protein, then inserts a screw that will open up both the disc space and the nerve tunnels that are causing the pain. The doctor says there's less blood loss, no scarring, and shorter recovery than a classic spine fusion.
The Axialif is an exciting new procedure, and to help us better understand it, we have Dr. Justin Paquette, who you just saw on the tape from Beverly Hills Institute for Spinal Disorders and Orthopedic Center. He's on the phone with us. So, Dr. Paquette, thanks for joining us.
Good morning.
So, who should be thinking about this type of surgery called Axialif?
Sure. I think the ideal candidate for this particular surgery is a patient suffering from either severe back pain or a combination of back and sciatic leg pain. Patients are usually in their 20s or older and have gone through all of our conservative approaches to therapy, so physical therapy, medication management, etc., and unfortunately failed that. In addition, we've actually also been able to use this for people that have had failed prior back surgeries and also as an adjunct to scoliosis surgery as well.
So certainly not the procedure after you tweak your back the first time, but a great new option for those suffering from chronic back pain.
Correct.
I mean, much different than a traditional fusion, right?
Absolutely. The standard way of doing this would be a big incision in the front of the belly and also in the back to get a fusion in the front and the back with a substantial amount of blood loss, many hours of surgery, and many days in the hospital requiring a long period of recuperative time. And this really cuts all of that down by a substantial margin.
Well, Dr. Paquette, thank you so much for sharing.
No problem. I appreciate it.
Great new technology.
Really great options for all.